Namaste. Apollo Hospitals Group is India's largest integrated healthcare provider. We have more than 10,000 beds across 75 hospitals with 8,000 clinicians in 55 specialties. We have Cradle, a network of birthing centers, Spectra, a chain of daycare centers, Fertility, a network of IVF centers, 1,300 plus diagnostic centers, a chain of dental clinics, a network of dialysis clinics, Sugar, a chain of clinics for pre-diabetes and diabetes, 260 plus primary clinics, India's largest pharmacy chain that will soon achieve the landmark of 5,000 pharmacies. Apollo MedSkills is the largest healthcare skilling institute in India. UR Life is our wellness platform. Family Health Plan Insurance is a TPA with a pan-India presence and a network of 14,000 plus healthcare providers. Medvarsity is Asia's largest and fastest growing health edtech company, having positively impacted the careers of 500,000 healthcare professionals across 192 countries. Leveraging nearly 4 decades of experience, we have designed Apollo Pro Health, a unique AI-enabled personalized health management program. Apollo Home Care has provided holistic care at home to 330,000 patients. Apollo Global Projects Consultancy has been engaged in 54 projects in 32 countries. Apollo Telehealth provides a spectrum of services breaking geographical barriers. Apollo Hospitals Education and Research Foundation, Apollo Research and Innovations, and Apollo Knowledge administer state-of-the-art research and academic programs. For us, clinical excellence is a scholarly approach to clinical practice with passion, passing on this mastery to the next generation of doctors and collaborating to enhance research. Our patient care stands on the 3 pillars of clinical, academic, and research excellence. For us, clinical excellence is giving hope to Mahindra with Nemaline rod disease, who has seen the world upside down his entire life. Mahindra after corrective surgery. For us, clinical excellence is giving hope to this family with conjoined twins that Abriana and Adriana can lead independent lives. Abriana and Adriana after their separation with the founder and chairman of the Apollo Hospitals Group, Padma Vibhushan, Dr. Pratap C. Reddy. For us, clinical excellence is giving hope to the parents of Sanjay with liver failure that after a liver transplant, he will lead a normal life. Sanjay is the first child to have received a successful liver transplant in India at Apollo Hospital, Delhi in 1998. Sanjay had discharge. Sanjay 4 years later. Sanjay 10 years later. Sanjay 15 years later, when the government of India issued a postage stamp marking 15 years of successful liver transplantation in India. 23 years later, Sanjay is now a doctor caring for patients at Apollo Hospitals, Bangalore. The highest rated hospitals are high volume institutions as best outcomes correlate with high procedure volumes. We have India's finest clinicians, hardwired systems and processes developed over 39 years that ensure excellent outcomes. We have performed 200,000 heart surgeries, 300,000 angioplasties, minimal access cardiac surgeries, complex neonatal and pediatric cardiac surgery. Structural heart interventions like TAVI and mitra clip are routinely performed. We've completed 1 million consults in patients with a malignancy, performed 3,000 bone marrow transplants, established 14 comprehensive cancer centers that provide radiation therapy, medical oncology, pediatric oncology, and oncosurgery, including robotic surgery. We have performed more than 370,000 orthopedic surgeries, including robotic joint replacements. Comprehensive subspecialty services are provided. More than 180,000 neurosurgeries have been performed. All subspecialty services are offered, including robotic spine surgery. From performing India's first successful pediatric and adult liver transplants, first successful combined liver and kidney transplant, more than 20,000 solid organ transplants have been performed. Kidney, liver, combined kidney, liver, heart, lung, combined heart, lung, pancreas, combined pancreas, kidney, and small bowel. Since 2012, every year more than 1,200 solid organ transplants have been performed. Even during the pandemic, 814 transplants were performed in 2020, and now every day, 4 transplants are performed. If any technology is available anywhere in the world, We brought it first to India because India deserves the best, be it cyberknife, robotics or proton therapy. The Proton Therapy Center in Chennai is the only proton center in Southeast Asia. When COVID struck, we deployed a 360-degree approach and launched Project Quach. The Quach experience was published in the NAJM Catalyst. We treated more than 250,000 COVID patients, developed the capability to perform 10 confirmatory COVID tests per minute, participated in 25 clinical trials, and administered 5.5 million vaccines. We ensure that our patients are treated in a safe environment. Our hospital in Delhi was the first in India and the 6th in Asia to get accredited by Joint Commission International way back in 2005. All our major metro hospitals are JCI accredited, which is considered the gold standard in global healthcare accreditation. All our non-metro hospitals are accredited by NABH, the Indian accreditation body. What patients and clinicians want goes beyond accreditation. They want excellent outcomes. We developed Apollo Clinical Excellence, ACE, a clinical balance scorecard in 2008. ACE is a case study at the Ivy Business School in Canada. We have 25 parameters that are benchmarked against the world's best published outcome. Each of our hospitals is expected to be in the green zone for each parameter every month. As an example, the best published survival rate after coronary artery bypass graft is 99.4% from the Cleveland Clinic. If our hospital has a survival rate which is comparable, it gets a score of 4 and 4, but with a mortality of 2.1%, it would get a score of 0. Many hospitals in the world would aim for survival close to 98%, but our hospital would get a 0 at 97.9%. Data from each hospital is reviewed and presented to the board. Remuneration of the CEO, COO, CFO, and medical director has been linked to clinical outcomes. We've developed the Apollo Standards for Clinical Care task that includes ACE, the Apollo Quality Program, incident reporting, mortality review, safe surgery, and ICU checklists. More than 1,000 trainees, 8% of India's national board trainees train in 45 specialty residency and fellowship programs at Apollo hospitals. We have 2 medical colleges in India, medical school in the UK, 11 nursing colleges, an institute of hospital administration, and a physiotherapy college. Our journal, Apollo Medicine, was launched in 2004 and is published every quarter. We have a robust presence in clinical research with an experience of 1,150 clinical trials involving drugs and devices. We have a biobank, a cord blood bank, and a growing interest in biomarkers and genomics. The Apollo team has worked on the design, development, and deployment of artificial intelligence-based APIs for clinical decision support for cardiovascular diseases, prediabetes, diabetes, liver fibrosis, antibiotics use, COPD, and asthma. Our AI COVID risk score saw 16 million downloads. With 4,149 publications, we have the 3rd highest number of publications in India on PubMed. Our telemedicine network was inaugurated by President Clinton in 2000. From 12,500 feet in the Himalayas to a presence in 48 countries. From urban healthcare centers to teleophthalmology to digital dispensaries to an eICU program. To teleradiology through Apollo Radiology International providing radiological services across India and beyond, to digital pathology linking pathologists across India covering 13 subspecialties of pathology. 13 million lives have been touched through Apollo Telehealth. Based on the learnings of 22 million health checks, ProHealth, the AI-enabled personalized health management program, has shown impressive improvement in clinical parameters of individuals through personalized, proactive, and timely interventions. Apollo 24/7 is the fastest growing health care platform in India with over 17 million users across 450 cities. This new age end-to-end omni-channel platform offers a full bouquet of healthcare services, 24/7 consultation, seamless medicine delivery at home across 19,000 PIN codes, diagnostic test booking, and doorstep sample collection, digital health records, and more. The Apollo Total Health Program in Aragonda and surrounding villages in the state of Andhra Pradesh for a population of 70,000 people, encompassing physical, mental, and social health, ecology, Spiritual well-being and economic fulfillment is now a case study at the Harvard T.H. Chan School of Public Health. Many honors have come our way, including 2 case studies from Harvard Business School, international and national awards and recognition. The greatest honor is that 4 stamps have been issued marking our achievements. 25 years of service to the nation, 15 years of liver transplantation in India, performing 150,000 open heart surgeries and completing 20 million health checks. We are privileged to have earned the trust of 200 million individuals from 140 countries. Thank you.